Good afternoon and welcome to the Pierce County Council's Public Safety Committee meeting. I'm going to call this meeting to order at 1:30. Clerk, would you please do the roll?
Yes, thank you, Mr. Chair. Councilmember Denson.
Here.
Councilmember Hitchin.
Here.
Councilmember Morrell.
Excused.
Thank you. Councilmember Herrera.
Looks like excused.
Okay. And Councilmember Yambe.
Here.
You have 3 members present.
All right, with 3 members present, we do have a quorum. And first, I want to do an approval of the agenda. Is there any changes or corrections needed to the agenda? All right, seeing none, we will say that the agenda is approved. Next, we have approval of minutes from June 22nd, 2026. Are there any changes, deletions, or corrections? All right, seeing none, minutes for June 22nd, 2026 are approved. All right, we are now at item 5. Ms. Andrea Kelly, our Principal Policy Analyst, please introduce this item.
Thank you, Vice Chair Yambe and committee members. For the record, Andrea Kelly, Council staff. So today we have a presentation regarding the Pierce County Sheriff's Office MultiCare co-responder program. So a bit of history on this. The Pierce County Sheriff's Office co-responder program began in 2018. The intent of this program was to have the appropriate resource available during a moment of crisis, whether that be for assessments in the field, telehealth consultation, or deputy consultation. The intent is to provide an alternative option for deputies in the field to avoid either the transport to an emergency room or Pierce County Jail when appropriate. In 2018, the program started with 3 co-responder FTEs, and those 3 positions were funded by the True Blood Contempt Settlement Agreement dollars. The program added 2 additional co-responders from the Behavioral Health Partnership Fund, and in 2021, through an application with WASPIC, the program was expanded for an additional 3 co-responders. Then with the passage of the Behavioral Health Tax Program and term limited funding from both True Blood and WASPIC, the Pierce County Sheriff's Office and MultiCare applied for behavioral health funding and have been funded through that source since that time. The current award for behavioral health tax for 2026-27 for the co-responder program is $3.9 million. There is an amendment in progress which extends services through 2027, and this contract pays for the entirety of the co-responders, which includes 9 designated co-responders, a supervisor, and part of manager and operating costs. Additionally, you'll hear about in the presentation today is the alternative response team. So with the establishment of the co-responder program, I don't want to go too much into the presentation, but the co-responders respond in a moment of crisis. And when that crisis has passed, been resolved, or is no longer meeting that definition of crisis, services are still needed. And so recognizing a gap in that, MultiCare and the Sheriff's Office established the alternative response team, which currently houses 3 FTEs, again, with the Sheriff's Office. Those are MultiCare staff. And this program provides for clinicians providing clients with crisis assessment, intervention, referral to services, and follow-up supports to prevent or reduce future emergency calls. That team also provides training to 911 and Pierce County Sheriff's Office staff on the best way to access behavioral and social services. This program is also funded by Behavioral Health Tax dollars. That contract has been fully executed and is for the 2026-27 biennium is $955,000. So in chambers today, we have MultiCare Behavioral Health Director of Crisis Services, Silvia Riley, and Crisis Intervention Supervisor, Chantel Quintero. I know your agenda says Lieutenant Tony Messenio. The Sheriff's Office provides a lieutenant to oversee this program, but it's my understanding is that person has shifted. So I do see Lieutenant Tara Similink in the Zoom room as well. And with that, I'll turn it over to the chair for further.
All right, thank you for that introduction. All right, So why don't we have Director Riley and Chantel come on up. Thank you for being here.
Good afternoon. Thank you for having us here. My name is Silvia Riley. I'm starting to look at familiar faces, not my first time here, but I thought I would start with giving you a little bit of an overview how MultiCare, in terms of crisis services, and the different contracts we have, and then the bulk of the presentation will be Chantel Quintero, who oversees the Pierce County Sheriff's Department Corresponder Program. So MultiCare is a very large healthcare organization, and we have the largest behavioral health network in the state of Washington, and that includes the programs that I oversee. We have the 24/7 program to respond to crises in Pierce County for adults. So for children, the contract with CareLawn that Catholic Community Services has in Seneca is for adolescents and family. MultiCare has it for adults. That's our largest contract to provide 24/7 to anybody as long as they are within Pierce County. Within that team, we have about 42 FTEs, all funded by CareLawn, the Administrative Services Organization. And in that team, we have a variety of staff that respond to crises in accordance to Department of Health requirements and WACs and RCWs. So we have our peer specialists, and those are people with, that have been part of the mental health system, either as consumers currently or formerly. We also have crisis care coordinators, and those are bachelor's level clinicians that help with a lot of the follow-ups for the people that we see in crisis. Then we have our crisis intervention therapists, and those are master level clinicians, and usually the first ones to respond when a crisis comes in. And then lastly, we have our designated crisis responders, formerly known as DMHPs. And those are the ones that are specifically designated to do involuntary commitment in accordance to RCW 7105. A little bit of background, those individuals were initially, many years ago, designated by Pierce County when they had the contract. But Pierce County designated MultiCare to be able to do their own training and designation, and we got the approval from the state. So when you hear about the DCRs, or designated crisis responder, whether as part of our mobile outreach crisis team contract with CareLawn or our co-responder programs, MultiCare is the only one within Pierce County that has the ability to do involuntary commitment. So besides the mobile outreach crisis team that has all those individuals in the team and respond 24/7, we have different contracts. We have a contract with the City of Tacoma for 2 designated crisis responders with TPD, and that gets paid with the 1/10 of the City of Tacoma funds. We have 1 crisis intervention therapist that's not able to do involuntary commitment, but we're in the process of changing the contract because they want to, with the City of Lakewood, they want a designated crisis responder. Again, that only MultiCare can do, so we will have 2 staff with Lakewood. We have 1 with the City of Puyallup that also gets paid by their general fund. Used to get paid with grants, but now it's being paid by their general fund. And we are in the process of negotiating 1 with Pierce Transit. There had been 1 contract, but Pierce Transit gave it back to the county, so we're in negotiations with that. And then lastly, our biggest co-responder contract is what Chantel's going to talk about, which is the one that Andrea talked about, funded with the Pierce County Human Behavioral Health Tax, and we're very grateful for that. I was the first person that started co-responder programs here in Pierce County, and that was with the Tacoma Police Department in 2014. Initially, we were going to have a crisis intervention therapist, but quickly, the assistant chief at the time says, we need a DCR because if we don't have somebody that can do involuntary commitment on the field, then our officers can do the same. They can take them to the ED and involuntary take them there. So it was very important for them to be able to have the person assessed in the community at the earliest intersection as possible to get the services to an individual as possible. So that sort of changed how we started doing co-responder programs here in Pierce County. So TPD started with that, and that's how we ended up with all these DCRs embedded in law enforcement. We were the first ones in the state of Washington, maybe even nationwide. So co-responder models are not new, but what we did differently is that we started hiring designated crisis responders. And the idea with that is that the DCRs can see on the field what's happening with the person instead of just going to an emergency department and do the assessment there. And that's very helpful because we're able to see not only what's happening with the person, but interview whoever's around them. And then if we find them to meet criteria for involuntary commitment, we send them to the emergency department already detained with all the right paperwork without sending individuals that don't need to be there. They don't need to be medically clear. We don't need to spend the money. We don't need to create more trauma. So I'll wrap up by saying, you know, I'm a strong believer in co-responder programs, not only because we're able to do the intervention as quickly as we can, but we are trained to do informed care. We build strong partnerships, having those staff embedded in the different, either the Pierce County Sheriff's precincts or in the different police departments. It really, you know, allows for that partnership because the types of crises that we respond to requires both of us. Requires law enforcement for safety, requires us to be able to de-escalate, to be able to assess appropriately, to connect to the appropriate resources, and also things that we don't talk about but are part of our contracts. It's not just the actual intervention, but the education that we're doing to all the new officers that come in, all the education that happens when you ride along with that deputy or with that officer. And also all those 911 high utilizers that get referred to the co-responders that now call them directly versus calling 911 when their concern has nothing to do with the need of an officer on scene, which allows us to be good stewards of our limited resources. So thank you for your time. I'll be available for any questions, but I want you to hear from Chantel. She's very proud of the work that her team has done. Chantel?
Good afternoon. My name is Chantel Quintero. I oversee the Pierce County Sheriff's Co-Responder Program and the Alternative Response Team. Thank you for giving me an opportunity to talk and brag about my teams. They're fantastic. They're amazing human whisperers. So they do amazing work, and it is a very stressful job. I'm going to just read this first slide. The co-responder model is to bridge the gap between law enforcement and community and provide a service and support for people who are in crisis. By providing mental health professionals intervention in the client's environment, the co-responder program aims to divert those to acute mental health or a substance use crisis from the emergency departments or jails to ensure they are receiving appropriate care and services. That is our main goal, is really to divert from the hospital and jails. We want to provide that resource, connect people to individual therapy, other resources. The next slide, I'm going to just go over the mission, MultiCare's mission, partnering for healing and healthy future. Our program really aligns with MultiCare's mission statement and our core values: respect, integrity, stewardship, excellence, collaboration, kindness, and joy. So if we could go to the next slide. Our staffing, we're contracted for 9 full-time co-responders. Right now we have 9 co-responders filled. I just submitted, knock on wood, I just submitted 2 offers to 2 new co-responders. So we're very hopeful, very smart. These co-responders are very unique. I would tell you they are the Code Blue of mental health. They are the SWAT team of mental health. They shine and do their best work when they're under pressure. They like that adrenaline. and that different change. They don't have 50 minutes to make a decision. They have 10, 15 minutes to make a decision out in the field whether someone meets that criteria. So it takes a unique person, very strong personalities, to be able to instruct and collaborate with law enforcement and be able to come to an agreement with law enforcement on what's the best outcome for this individual or family. So, and the co-responder has to be okay with being in the limelight. There's, you know, as social media is, there's always someone with the phone, and that could feel very intimidating, especially when you have a sergeant or a lieutenant on scene and maybe 3 or 4 deputies, and then now you got the fire department and maybe the chief, and so they're all waiting for the co-responder's response. We also have 3 care coordinators for the alternative response team. They are contracted for 3. Right now, 2 are filled, and we have 1 open position. So just like what Andrea said, Pierce County Sheriff's Co-Responder program started in 2018. In 2020 is when Pierce County Co-Responders went regional, where they respond to all of Pierce County except for the Tacoma and Lakewood areas. The reason is those 2 agencies opted out because they have their own program. All the administration is managed by MultiCare. The designation is done by MultiCare Behavioral Health so they can be able to perform ITA evaluations, which is involuntary treatment acts. The gear that is provided by Pierce County Sheriff's and MultiCare Behavioral Health. They get a ballistic vest, a county radio, county laptop, MultiCare cell phone, MultiCare MiFi, and the county provides uniforms. That means jacket, shirts, cargo pants, boots, because those scenes can be very unpleasant, and it's to protect themselves. Co-responder, also, they have extensive training. They have 3 months of training at the precinct with our lead, Alex Brown, and she does all the training for our co-responders. She is fantastic. She is consistent, safe. She goes by the rules of the RCWs. She is good. And then from that point, they get transferred over to the mobile outreach crisis team to get 3 more months of training around the RCW, so they get really good practice of doing ITAs. They know that petition paperwork. So by the time they come to the precinct and ready to roll out by themselves, they have to be solid. They have to be strong to be able to stand on their own, because this is a very independent job. The co-responders and care coordinators are based out of the Parkland precinct because this is the centrally located area for Pierce County. Some of the, what do co-responders do? Next slide. Sorry, I'm not keeping up with that. Co-responders' response goals is complete mental health assessments to address needs of individuals on site, crisis interventions and de-escalation, and sometimes that means that the co-responders are responding to this negotiation teams. They get training once or twice a year with the negotiation teams and provide to be a professional resource to consult on the individual that is part of the responding to in the call. What's nice about MultiCare, we have an EPIC ad database which has a wealth of medical and mental health information, and the co-responders have access to it. So we can see in the moment if that client actually saw their therapist that day, and we can reach out to them. We can see what the notes are. We could see if they didn't refill their medications. We could see, you know, we can reach out to the provider and see if we could get them an appointment that day. We also assist in voluntary treatment options and resources, the divert and reduce persons from going to jail or to the hospital, follow-up interactions with individuals at risk and high utilizers of services, and then involuntary detention, ITA investigations. Some of our limitations are unable to prescribe medications, unable to provide transportation to clients, unable to replace the role of a negotiator and law enforcement, unable to provide individualized therapy, unable to meet clients in the community without a partner, which is a big deal. That's for safety. So next slide. How are we being utilized? To prevent a revolving door of the ED visits, reduce the number of misdemeanor arrests as legally appropriate, and bridge the gap between resources. Continued education through formal training and in-time co-responder consultations. Fostering trust between the community and law enforcement. Rapport building between law enforcement and the professionals and other professionals. Advocating for an in-person co-responder contact and therefore allowing for face-to-face crisis intervention. And that is the most accurate way to assess an individual, is to do a face-to-face. Program goals, reduce taking, some of these things I'm repeating, so I'm going to just kind of breeze through the next slide. I'm going to breeze through it. Provide a referral option for law enforcement for follow-up. Reduce impact of frequent non-emergency calls. Provide all law enforcement with mental health related tools, including real-time consultation, person, phone, radio, email, MPS. Provide resources and education to individuals and their families. And then just reduce taking people who are mild to moderately mentally ill to the emergency room. I want to take this moment to talk about the alternative response team. That's ART, the acronym for ART. They are contracted through Pierce County Human Services for 3 care coordinators. We have 2 right now. I had a huge push when I was a co-responder for something like this to start, because the co-responders were running into difficulties in getting follow-up, quality follow-up for individuals that needed to get connected to services. Either they didn't have the right insurance, they weren't on Medicaid, or they just fell through the cracks. There was no response from these other programs. And so for me, I think about my family. How would I want my family to be treated? I want that extra level of care. I want someone to hold their hand until they get connected to services. And that means maybe going to the appointment with the individual, going to their house and checking in on them once or twice a week, helping them fill out paperwork. When someone's in crisis, it's so difficult for them just to read a sentence and comprehend it, because they're in survival mode. And the alternative response team has created a level of service, Silvia likes to call it the Nordstrom service, where we provide that extra level of care. The co-responders can't wrap a call up with a pretty bow in 10 to 15 minutes. They need that extra care afterwards. So the co-responders will do a warm handoff, do a follow-up, and they'll go out with the care coordinator and introduce the care coordinator to the client and the family and do that warm handoff. And that's the extra level of care. They are so fantastic. We have a care coordinator. He's fairly new, but has a lot of experience. His name's Jarek. And there was a client that she was so worried, elderly client, she was so worried about her landscape, her yard, that she was going to get kicked out because her grass was too long because of the HOA. And Jarek, he was desperately calling everywhere, asking, hey, what can you help? Can you help? He even pulled over on the side of the road and asked a landscaping company if they'd be willing to do that. But they ended up getting Catholic Community Services with their volunteer service to come out and mow her lawn and continue to do that for her. They even recognized some other issues like the porch, needed to be fixed, and the fencing. So this is the level of care that they give. And we wouldn't have that. The co-responders wouldn't have time because they're busy on 911 calls. And this is that extra hand-holding that we need, that Nordstrom level care. Yeah.
Let me ask a question from Committee Member Denson.
Thank you. Chantel, I can so appreciate and I'm so grateful that you have these folks in the community, because I often wonder what happens. Can you explain to me what kinds of cases, what kinds of people get that warm handoff to the alternative response team person?
So anyone that's willing to receive services. So I encourage someone who has not had, if there's not an ITA assessment done, or not an assessment, but a detainment, then the co-responder should be making that referral to the alternative response team automatically and seeing if the individual and families would like a follow-up from the alternative response team.
Okay.
So everyone.
Okay, but the referrals, do they only come from co-responders?
So we have an email, a group co-responder email, and different law enforcement agencies emails us about follow-ups, that calls that they've been on and that the individual or family is requesting for services.
Okay.
And then I recommend, it's required for the co-responders to screen that referral to make sure it's an appropriate call for the care coordinators, because the care coordinators are bachelor level clinicians. They are not master level clinicians. So we want to make sure we're setting up our care coordinators for success and not feeling overwhelmed and overloaded.
Okay, I guess and this may not be an appropriate role for the care coordinators, but I always am concerned about families that may have had an individual die by suicide, for example, and then the families are left needing some extra support, and you would think they would know where to go because we are so in this, but I have found that often they don't. And then the other example is like a family that maybe has had a homicide. So there was a homicide that happened. I know we have chaplains, but do your folks go out and visit with those families and try and get them the help that they need dealing with this?
Sometimes the chaplains, that is the chaplain's role, and they will connect that individual to services. Now, if the deputy or officers or troopers make a referral, we go out. Our co-responders are very proactive. They're watching the 911 board and seeing what calls are appropriate that has a mental health component to it. And they're always looking up history. They're checking to see if, what's going on. They'll contact the deputy. They'll contact Southside 911 and ask, do you want some information? Do you need us to come out? Actually, I'm on my way. I think this would be an appropriate call for us to go on.
Great, thank you.
Any other questions? Okay.
And then the next slide, I just want to go over a little data. So this is a little bragging, okay? So we have a 27-minute average response time so far this year, and that's a big deal because we're going all over Pierce County, from Gig Harbor to Bonnie Lake to Eatonville. We've had 753 of contacts diverted from the hospitals since this year, 182 diverted from the jails. And why it's 182, sometimes not all calls have to do, that person is not at risk in going to jail. They just need services. Also, sometimes we don't know the outcome. 7% of all contacts resulted in being detained for an ITA. 437 of the contacts resulted in referrals for 2026, and 92 of the contacts declined all services so far in 2026. Next slide. This talks about the Pierce County and alternative response teams numbers. First quarter, we had 343 hospital diversions, 62 jail diversions, and as 66 ITAs, and 42 of the 66 ITAs were detained. And as of right now, for first quarter, it was 570 crisis interventions. For second quarter, we had 335 hospital diversions, 98 jail diversions, 52 ITAs, and out of that 52, 40 were detained. They met that criteria. And then the total of 525 crisis interventions. As of July 21st, we have 753 hospital diversions, 182 jail diversions, 132 ITAs, 94 were detained, and a total of 1,202 crisis interventions. Next slide, please.
Chair.
Go ahead.
Go ahead, Board Member Hitchin.
Thank you. Thank you for bringing data. Big fan. One of the things in reading the data, if someone is referred to treatment, maybe goes to detox, where is that in this number, in this graph?
So that is the ITAs.
Okay, involuntary treatment is ITAs?
Yeah.
Okay.
That's saying, if they went, ITAs represent rights have been read, okay? Co-responders have read the rights to the individual. The detained part is the actual number of people that met that criteria. So it's the detaining that's on that slide.
Okay, thank you.
The next, we got there. So, services provided, 1,816 total unduplicated clients. These are the first time we've seen them this year. 3,555 duplicated clients, that means repeated clients. 132 ITA assessments, so that means rights have been read. 94 were detained of all those ITAs. 1,202 crisis contacts, that's including ITAs, phone crisis interventions, and face-to-faces. And then the consultation is 1,307, and this is an opportunity where law enforcement is contacting the co-responder, asking more information about the individual, if they have history with the crisis team. Also, any suggestions or tips to help them with that call. And when they have that consultation, that's when they do say, hey, this is a great time for us to go out. This is a good call. If this person is exhibiting this behavior, this is the time for us to go. I also included the age groups for Pierce County Sheriff's co-responders and the alternative response team, because I think this is important to understand the demographics and age groups that the co-responders and the alternative response team is responding to. 12 and under that we've seen 55, 13 to 17-year-olds 196. And so this means not several times. We usually see them many, many times, but unduplicated. And then 18 to 25, 199. 26 to 54 years old, 877, and 55 and older, 481.
Board Member Hitchin.
Thank you. For youth, again, because this is the co-responder, there's a law enforcement component to this. So can you help me? I'm just trying to understand, is it showing up? Are you connecting through law enforcement in schools? Are you connecting family violence where there's behavioral health concerns? Like, can you help me understand that number? Because I know we also have the WISE teams that show up in community.
Absolutely. So we are responding to active 911 calls that families are calling in about their child. Maybe there's, threats of suicide or harming someone, or they're self-harming. Sometimes friends are calling. The kids' friends are calling, and this is where the co-responders are looking up information. The kid is posting stuff on Facebook, and we've had co-responders that will look up where the phone number of the individual, or they're able to find that individual and reach out to the parents and let them know and inform them that their child is at risk. And we're talking like, soon as that call comes up, it takes them 5 minutes, and they're like, no, I didn't know that. Johnny's sitting right next to me. We'll have that conversation with him and see what's going on. It is a remarkable team. They are so proactive, and these are the things that they're so proud of, because they feel like they're saving lives and really being an instrument in helping the individual. We also get it from school resource officers. So if a school resource officer has an adolescent that is suicidal or a danger to others, they will ask us to call. We know Catholic Community Services holds the contract, but because our contract is with Pierce County Sheriffs, we respond to everything. But what our co-responders do is we coordinate with Catholic Community Services. We'll call their back line. Hey, we have this individual. Can you, law enforcement is requesting us to come out. Can you meet us there? And we're really collaborating with the other agencies like Catholic Community Services to come out and provide that resource. So the WISE team.
Okay, thank you. That's helpful. Thank you, Chair.
So, so when I was a co-responder, we still have the same barriers as when I was a co-responder in 2020. And these concerns are ongoing, and regarding resources that cause co-responders and care coordinators to bang their head against the wall, because sometimes there's nothing that we can do. There's not resources in the middle of the night, and sometimes we have to walk away. There's nothing we can do. And that is so frustrating. And so one of our biggest ones is the housing issue. Having emergency housing 24/7, not just Monday through Friday, 8 to 5, no holidays. 24/7, what does that really mean? And then the transitional housing and permanent housing for these individuals. And when I say housing, not just for adults, but for the families with pets, and people with disabilities. There's limitations on certain individuals with some of the housing, the shelters that are out there. We also need respite care. Respite care would be critical with providing individual counseling, family education, and connecting them to resources. Respite care would create a timeout for the families and the individual. And the people that I'm really concerned about are the adolescents. They need that timeout. They used to have it. They used to have it back when I was a teenager. They don't have it anymore. Also with dementia clients, we have a huge increase. This last week, my co-responders, we have flux ups and downs, certain trends that happen, but last week was a lot of dementia clients that we saw. And there's no resources unless it takes time to get them to a facility, aging facility. There's also an education piece that needs to happen with the family. There also needs to be kind of liaison to help them with the paperwork and support, counseling for these families. This is important. Also, developmentally delayed and autistic individuals, we need support for them. It just seems like some of the support that we do have, it's hard to get into. The beds are full. And so the next option is go to the hospital. Also, the lack of substance use disorder treatments and detox facilities. The beds are full, or they might have a disability. They might have a dog, and this is something that they're concerned about. Also, we don't have a crisis stabilization facility. That's a huge hit. That was a huge hit to us, not having that. And that is so crucial, and that's something that we need. Next slide. Now, this next slide, this is future planning. I call it future planning, but I call it Chantel's wish list. All the co-responders, I would love all the co-responders, including Tacoma and Lakewood, to be under one contract with Pierce County Sheriffs. It would just make more sense. That makes Pierce County Sheriffs be able to respond to Tacoma, Lakewood, and not just everywhere else but them. They got two people, and that's usually Monday through Friday during business hours. There's so many times that they call requesting us to come out and help their officers on a call. So that would be a huge wish list. Also have the alternative response team under that same contract with Pierce County Sheriff's co-responder. That's a huge thing. They're part of the team. I know it's two separate things, but they are embedded with law enforcement. They're embedded with the co-responders. This is important. It provides a level of service that we didn't have before when I was a co-responder.
Thank you. I just want to dig into that a little bit. So is it that you want co-responders to be able to respond to any jurisdiction, and you want that partnership where we don't have like these two over here go to Lakewood and only Lakewood?
Correct.
Okay. And then Lakewood funds their own to make sure that they have them. Mm-hmm. Tacoma funds their own because to make sure they have them. So I guess the question I would ask that you think about and maybe send back to our side of the house is really, what is the size of the team necessary if that was the model?
Oh.
I mean, granted,
I know.
I'm just, sky's the limit. This is your dream, I believe you said.
Yeah.
So like, what would be the size of the team to really meet the need?
If I was shooting for the stars, I would say a co-responder for each deputy or each officer.
So 300 but that's on duty. Okay.
You asked me.
I did. But the thing is, so that's the thing. Like we don't have the right to respond in other jurisdictions. So you would deploy without a deputy to Lakewood to then meet them. Mm-hmm. Like we wouldn't have, like it gets way more complicated if we are sending our officers to another location.
So they would meet the other Tacoma officer on that call. Right. They would meet the Lakewood officer on that call. It wouldn't be utilizing a Pierce County deputy. It would just be, we'll be just responding to all of Pierce County.
Okay.
Just like we do with University Place, Bonnie Lake, Gig Harbor, Fife.
Okay. Thank you.
Also, to retain co-responders, I would say increase pay to match other programs, retention bonuses, continuous sign-on bonuses. Some of our challenges are, it takes about a year for a co-responder to really get trained, to feel confident, to feel confident to be on their own. That's the marker, is a year. And so when we're investing that much, we want to retain them. This is a huge investment. And if we can just retain, and if that means some salary increase, something to make them stay longer term. I would tell you our program is leading in the nation. We had someone from Eastern Washington in law enforcement and with the co-responder programs up there, and they said, you're doing it right. You're leading the nation. You're the model we're following.
Chantel, I have a question about that. What's you said that there's two hires left, but what's the turnover for crisis care specialists? And
For a while there, we couldn't get past 6, and then we dropped down to 5. And then last year we got to 7, and then 8, and then a couple left, and they went to King County. The level of not only training, but they have to go through a background check with the Pierce County Sheriffs. And that's reasonable because they're around evidence, they're around firearms, they're around, information that's confidential. And so that's to be expected. But it is extensive background check. It is invasive. And not everybody passes them. And those that do, and then they get trained, and then they get a better job offer because they just got trained. Yeah.
This is something that we're tracking at MultiCare very closely with human potential partners. I think since COVID, you probably heard every social service agency talk about the same thing. In fact, I'm part of the behavioral health workforce consortium, and there's been a lot that's been done. So I thank you for that. And I'll tell you a little bit about what we've done in the last few years, which is, as Chantel mentioned, we're doing things that we never did before in social services. I've been on this field for 36 years. We're doing sign-on bonuses. We did, Carolyn was able to give us retention bonuses for all of our crisis employees, including those that they don't contract with, like the co-responders. We have a very nice, and again, I thank you, line item under the budget for conferences. Just so you know, MultiCare for all their behavioral health network, and we're talking about 3,000 plus employees because that includes inpatient and outpatient counseling. They get $250 a year for continuing education, which is required in order to maintain their licenses, and classes are expensive. Our co-responders are able to go to the national conference. So we've done a lot of advocacy to keep our co-responders. So back to what MultiCare is tracking since we started tracking, I believe the nationwide trend around behavioral health workforce is around 30%. In behavioral health last year, we at MultiCare was around 26%. Our crisis team was 9%. So we were, why? Again, because we're able to do some of these things which mean a lot for the staff. We may not be able to give them a lot more per hour, but we negotiated, like, you can get additional education funds. We now pay for their licenses, which we didn't do before. MultiCare is doing things like, what are they called? Additional tuition reimbursement to motivate. We're going to have in the mock team 2 staff that will be promoting to different positions because we're able to help them with some tuition reimbursement. So I wanted to highlight that, we feel very good about where we're at, but it's not enough because we just lost a co-responder to King County. They're county employees after all that investment, and they make a lot more per hour. So those are the challenges. I wanted to highlight that we're doing what we can, but why was it 9% for that crisis team? Carolyn gave us that additional retention bonus, which $15,000, which is a lot, but they had to sign a 2-year agreement. So I'll be really curious to see what it's like next year.
2-year agreement that they'd stay at that agency.
That they would stay at the agency, yes, yes.
Okay.
And I've had staff tell me that as soon as that's done, I'm leaving. So yeah, I hate to say here, well, money, because I don't believe in that. For me, who I report to, my schedule is also very important. But we're dealing with, workforce that they know. They are a very much needed resource that can also, you've heard me say this and I'll say it again, they can work out of the comfort of their home in their pajamas 4 days a week. Our co-responders have to be in very difficult calls. We've seen an increase on family leave request for how it's impacting their mental health. We've seen, because we also track and report on those more, what are they called? When we have, oh my gosh, the word just escaped. When we have incidents on the field that result in a completed suicide or a homicide, here reports, but they're, the word escaped me, but critical incidents, increasing critical incidents, not just in our team, but, we're seeing more lethal means of people ending their lives, which is very concerning. We've done some education in the community about that, but it impacts our community, but guess what? It impacts our employees tremendously. So those are some of the challenges I just wanted to highlight.
Board Member Hitchin.
Thank you. Thank you for stepping up and discussing that. I guess the county doesn't mandate the pay or the like that's all under MultiCare. We just put the RFP and the contract out. So even if we did increase the money, we wouldn't be able to say, go pay these people more. I'm assuming the MultiCare is making those decisions. Is that an accurate?
It is accurate. It is accurate. And MultiCare will also say you can't pay those that you have a contract here more money. We had another contractor with a corresponder program that wanted to pay hazard paid, and MultiCare says we can't do that because we don't do that for nurses. So yeah, under MultiCare, there has to be consistency amongst workforce, and also DCRs in this position have to get paid pretty much the same as the DCRs in here. We did advocate very hard, Chantel and I, about 4 years ago, so our corresponders do get additional $2.50 more an hour. We can't call it hazard pay, but it's a way to acknowledge their environment that they work in and the circumstances, and additional things like having to go through an additional very invasive background check that some of our employees, MultiCare does background checks, don't get me wrong, but these are very in-depth, very invasive, so, but yes.
I have a question. So let's say the total people that you send to get background checks, and then how many actually make it out? Like how many, for law enforcement, it's like, you can send 800 people through the process, but then in the end, only, X amount make it through. So I'm curious on this, how many people aren't?
I would say over half.
Okay.
Over half. Only a few people get through.
Yeah.
Is there sorry, Chair. Is there a specific thing that is triggering that maybe is something that's really important in law enforcement, but maybe as a crisis responder is something we need to think about how we're doing the background checks with because I'm assuming they just use the same for all, but your work is we're not handing you gun. We'll just say that. So I think it should be the same background check, because there's some things that they have a different lens than I do. I can see both sides of every argument, right? And they see it at a very different lens. And I would say they're pretty accurate. Okay.
We're talking about maybe they had that criminal history, financial situation, maybe something that happened in a previous employer that was questionable, the lying that happens in the background interview.
Because, it narrows down the pool, and then further narrows down the pool, which makes, if King County is being aggressive and saying, hey, we need X amount, and, and we can't always compete materially. Yeah. And, like at the county, we have to provide, a good working place, a, reliable schedule, those things. And it seems like, you all are thinking about those little things, but I just want, for those watching to get an idea that it's not just simple, how hard can it be to hire these, and then, these services, is it worth the money? And it's like, yes, but there's a lot involved.
Yeah. And you have to remember, these co-responders are working independently. You know, I work Wednesday through Saturday. I'm only there for a little bit of time. So they got to be able to work independently with integrity, doing the right thing when no one's looking, because it would be easily to take advantage of. So this is why it's important to go through that background check.
And I think that's one of the hurdles that I think of when you talk about co-responders being in all one place, is that, you know, it's like you can have a staff, but then are they all available at the same time to respond? And then some cities will be like, well, you know, we pay this, so we should be getting X, and then, you know, the other jurisdiction says, hey, you know, the same, and so it complicates that. But,
It does.
But I appreciate it. Okay, keep.
And then I also would like to have a crisis service dog. This would be able to help the co-responders when doing assessments, be able to reduce anxiety for the clients and families. They've had huge success in other states with the crisis dog. And then also they have these crisis dogs respond to natural disasters or maybe a school shooting, and they're able to bring the dog through and bring down the level of energy that's on scene at the time of that crisis. So just some huge push for this. We got to meet at the last conference we went to in June. We saw a lot of crisis dogs, and they were fabulous. They were wonderful. I got to play, and it's good for my mental health.
What's stopping you from getting a dog? I say yes, let's do that.
Funding.
Okay.
Yeah. Funding.
We need a council dog.
Hypothetically, how much money goes into training such a dog?
So they have dogs already trained. I believe, I'm thinking it's about $15,000 for the dog, and then after that we would have, you know, just the food, the vet bills, and then the dog handler would go to once a year conference for the crisis dog to get training.
Oh, they'd probably have to be certified.
Yeah.
Yeah.
And I'm working on, you know, it's hard, you know, I'm working on trying to get funding, but, you know, it's always nice. What do we do when we get the startup cost? Can we retain it, right, after we get that startup cost? Are we able to maintain the cost of the care of the dog?
Okay.
I'd also like to bring on a nurse practitioner with the alternative response team. I really see them working side by side together, be able to go out in the field with this, Deputy Avalos and going to the homeless encampments, providing assessments, providing resources. Maybe it's bridging that gap until they get connected to someone permanent, and maybe there's a prescription that they can fill for antidepressants or something like that. I can really see that being helpful. This is boots on the ground.
Board Member Hitchin.
Thank you. I just did a ride along with our street medicine team with the health department, and if your team is not carrying their cards that allows people to actually contact them and request they come to them where they are, potentially it would be a way without a nurse to say, and then they can do it, like they can make the decision of whether or not they want to seek medical care, but it would allow you to provide a connection. I have a stack in my office, but did not bring them down. If you want to connect after this meeting, I can run back up.
Okay. And then also the Narcan program. I think we added it to this contract, but that would be just wonderful for every one of us to carry Narcan, making sure we're visiting, we're handing them out, creating that warm contact. You know, I imagine offering services, treatment. I imagine they're going to say no and other things, but eventually we'll build that trust, and they will say yes eventually when they're ready. I want to share one story, and this one's dear to my heart because this individual was active when I was a co-responder in 2020. She is a 57-year-old Caucasian woman who is a high 911 utilizer, and her diagnosis is schizophrenia. She would call 911 reporting that Bill Gates had stolen millions from her. She would call saying there was a little boy that got kidnapped, and the kidnappers and the child is in her floorboards. And she would call 911 20 to 30 times a day. And this is tough because these audio and visual hallucinations and paranoid, they don't go away. When I was a co-responder, we would call this individual, talk to her, do some reality checking with her. And that would reduce her 911 calls, maybe to 10 a day. And now that we have the alternative response team, what's nice is we have the co-responders and the care coordinators actually going out because they have a safe second to go out and visit her. She's able to get a human contact, and the team has created a reality-based checklist for her to have right next to her phone. It's laminated, and she has to read it before she calls 911. And they go every week to check in with her. She still calls 911, but not as often. And she is also, you could tell that she's connecting and remembering the team, like, oh, I did call 911, but, she was able to reason. She goes, I know, I just was scared, This is huge, People who are diagnosed with schizophrenia or schizoaffective, when they're alone, their symptoms get worse. They're away from their families. They don't get that reality check-in, which they would get from their families. They're alone, so they're left alone with their thoughts. And so having both teams, the co-responders and the care coordinators, go out and check in is remarkable. That is the best solution. The co-responders are there. I guess they didn't have to go. They can have two care coordinators go, but it's always important to have a co-responder there because that individual could meet criteria for an ITA. And so they're always assessing, seeing if she has food, seeing what's available, how's her house, making sure she's safe. And this is the best outcome. Our team has done an amazing job since 2018. And they continue to provide resources and care for individuals and families and for law enforcement. They have saved lives, literally saved lives with individuals and families, and saved the lives of law enforcement because they consulted with the co-responder first. We still have a lot of work to do. We can always do better, And so please take in consideration of my wish list and the barriers. But thank you. Any questions?
First of all, I wanted to thank you for the presentation, but all the work that you and your teams are doing in MultiCare and our co-responder program. I think it's been a game changer overall, and I think that's one of those things that is something that was much needed, and I'm appreciative that we're in a time that we're able to invest in some of those things and work those things out because the old ways weren't working, and they won't get us out of the future problems that we're going to have either. So, any board comments, questions? All right, Board Member Hitchen.
Thank you. So one of the limitations you talked about is being unable to prescribe medications, and then there's the whole thing that they then can't get the medications even if you could prescribe them. That is a conversation that's happening around the county. It'd be interesting to think about what it would look like if you were able to, how people would access them. But just curious, would it just be having a licensed nurse or some sort of could it be someone else who has the authority but maybe isn't out in the field who's able to do that?
Yes and no. Yeah, we could always refer to other programs, but when a client is ready to take the medication in that moment, we have to take that opportunity. And that would require a nurse practitioner to be boots on the ground, to respond in the community, and to be able to say, okay, great, let's go ahead and Maybe it's transporting them to MultiCare Behavioral Health in Puyallup, and then that's where they start getting their medication, but they're able to prescribe it and connect them to services until it's permanent.
Okay. Okay. Thank you.
Any other comments? Okay. No, we appreciate it.
Thank you.
All right. Okay, we'll move on to other business. We're now at item 6. Do any committee members have any other business? Ms. Kelly, can you give us a preview of what we have coming up?
Certainly, thank you. Your next committee meeting is scheduled for Monday, August 10th. At this time, there's going to be a presentation and an update on domestic violence weapons surrender. That process has the Sheriff's Office and the prosecuting attorney have had to adjust due to case laws and appellate opinions, and so we will hear the final on that and current process. And then pending approval on an upcoming consent agenda, there's legislation is anticipated to be added to that agenda as well.
Okay. Well, thank you, Ms. Kelly. Item number 7 is adjournment. Seeing no other business before us, I'm going to adjourn the meeting at 2:36. We are adjourned.